All right, welcome to the vendor event and welcome to Cisive Pre Check. We've brought Brad Gary here and Georgia Gray, and they're going to talk about their product.
Fantastic, Wendy. Thank you very much. As Wendy mentioned, I am Brad Gary with Cisive Pre Check. You might also hear me use the term student check, as that is the direct product I'll be speaking about today, really directly around our student screening platform. Wendy, thank you again for having us on. Georgia, good to see you again. Great presentation this morning on Trajexis. I'll give you a little bit more detail on that team. Quick backstory, I met Wendy back at the Odin conference in Nashville in November. Wendy came up to the table and to our booth and was very excited to hear and learn more about Student Check by Cisive Pre Check and how we're helping schools with the entirety of the student screening services. And luckily enough for Wendy, she was the proud winner of our Ray-Ban Meta glasses as well. Wendy, if I'm getting too much detail, I think she was kind enough to actually gift those to her husband as well for an early Christmas or holiday present, which was fantastic. I've been bugging her to see how they work because I've never used them. And she said she hasn't pulled them out of the box when I talked to her last. So, but anyways, thank you all for being here. Again, as you can kind of see on my first slide here, it's asking, where have all the nurses gone? Key findings impacting the nursing pipeline. I'm going to be sharing today a little bit about some surveys that we have conducted over the past months with non-clients operating and conducting student screening operations, and where some of those inefficiencies and frustrations are coming from. Right, and really it's around some of the clinical placement challenge in the nursing education. I'm going to say nursing, but team, if you are not in a nursing program, if you are in phlebotomy or RadSci or any other health program, this directly applies to you as well. We did ask a lot of our nursing counterparts for this information. We actually got feedback from over 300 admin and faculty and over 150 students responding to the surveys. Again, around some of the general inefficiencies and frustrations with their current student screening programs. So I'm going to kind of give you what we have found, and maybe you're hearing some of the same things or seeing some of the same things with your student screening programs. And then I'll kind of get a little bit more into Cisive Pre Check, directly our student check solution. And how implementing these services have really changed the gauge for a lot of organizations. And I'll share a quick blurb from one of our clients as well. And then, as Wendy mentioned, we'll open it up for a good Q&A. And please, no questions are bad questions. If you have anything, I'm here to assist with all of that. Kind of hopping into some of the survey questions, a lot of the feedback we got was around the clinical placements are really the single most frequently cited operational inefficiency. 30% of administrators were naming that as their biggest issue. What did that directly mean to the schools? 90% of admin report difficulty securing and placing their students for their clinical rotations. The inefficiencies in this area have really created just a bad negative domino effect that was impacting and affecting the entire school, the programs, and some relationships with clinical sites. The data from that is presented here, right? That 30% of clinical placements is that there just wasn't enough sites at times, right? It was never really due to no inefficiencies. As you can see, not a single respondent said that everything was perfect, that there were some current inefficiencies within their screening solution. But the three really that come out, and it's no fault of yours, is faculty availability. I think there's more students nowadays trying to backfill the silver tsunami evacuation in nursing. And schools are having a very difficult time hiring the correct faculty and admin to teach these kiddos. And then that last piece was really around the technology or the systems just being inadequate or very inefficient for both the admin of the school and the students as they're trying to get ready for their clinical rotations. Second piece we really got into was around the onboarding delays, and nearly all administrators report that students face at least occasional delays due to onboarding and or document issues. And these delays really will result in postponed or missed clinical rotations, which we know happens and it shouldn't be happening. When a student is set, they have everything in order from an educational standpoint. We can't let their compliance tracking or immunization tracking be the hiccup that delays them from making their clinical rotation. Really got into around the current screening landscape. What we were finding is that it was highly fragmented by not with 62% of programs relying on two or more vendors to clear a student. And that is two or more screening vendors to clear a student. And what does that mean for the students? And what does that mean for the school? It really, that fragmentation of utilizing multiple vendors was creating tons of manual work for both the student and the placement coordinators, inconsistencies, and just a really high level of increased risk of errors in their immunization tracking, background check, and or drug screening. The good news here, obviously a lot are 62% are using two or more. No one was using five or more. And if you are using five or more, please call me because I need to hear about that and how much of a headache that might be for you. Really, it's now what are schools looking for? So we kind of hear what was happening. It's fragmented, it's onboarding delays, it's immunization tracking inefficiencies and delays. Schools are really looking for vendors who can interpret, normalize the clinical site requirements. So how does PreCheck help with that? Well, Cisive Pre Check, the PreCheck name is our health specific vertical. And we work with over 70% of the acute care centers across the states for their employee background screening, drug testing, monitoring of license, et cetera, et cetera. We have really great relationships with all these hospitals, and we totally understand what it takes for a student as part of the IEDRC cohort, not cohort. Wendy, what is it? What's the C? Why can't it come to me? Consortium, excuse me.
Consortium.
That consortium. Thank you. We understand, so we work with a lot of these hospitals and we understand exactly what it takes from a screening perspective, both background and drug, and really as it relates to those immunization requirements, what the students need to fulfill to become, to an intern or do their clinical rotations within those facilities. Really the biggest frustration around the screening process from an admin side, non-student, this is just the admin side, were two things. Were the asking for faster turnaround times of screening results, and that was again from background, drug, and most importantly, and what we heard the most was around that immunization tracking. It was just taking way too long to clear a student or work with a student to get them cleared. And the second piece was the was the lack of integration with any clinical placement systems. So they might be using a fragmented double screen that doesn't integrate with any type of clinical rotation software or clinical record keeping that the clinical sites are using. Really, there's just a strong demand for real-time status tracking as well on the admin side to ensure when you pull the reports and are sharing that with clinical sites, that it is accurate and that you are able to provide that very, very easily to your clinical sites if there is no integration included. For those of you that were on the 8 o'clock session with Miss Georgia of Trajexis, she mentioned, and we're very happy to announce that Cisive Pre Check and Trajexis are now partners, are integrated partners for all programs. So really, what does that mean for anyone utilizing the Trajexis solution? Any status updates that are made within PreCheck, our student check solution, are auto updated within Trajexis. All right. So a student who makes an update within Cisive doesn't have to go out to their CRS solution and try to sync it up. It auto flows right into that. Really, what is this doing for the students and admin? It's just ensuring compliance for the student, the institution, and the clinical site, making sure that all pieces of the background screen, again, background, the criminal side, the drug screen, and all of the vaccinations are fully in line. And if a clinical site is utilizing Trajexis, everyone has direct access to that. You don't have to email or compile anything to share with the clinical site. We actually work with a handful of associate degree programs and schools currently here in California, and they have given just a wealth of yeses and thank yous to myself and Georgia for these integrations and partnerships we've afforded to the schools. Really, the last piece I know we mentioned, or I mentioned, we surveyed admin and faculty. We also surveyed a lot of students. Students are feeling the pain of the broken processes as well. Among students who have begun the clinical placements, almost 89% have reported encountering some type of challenge during the approval and or onboarding process. The biggest piece was around 1 in 4 were having difficulty uploading the documents into their screening solution. And then also within any type of onboarding portal, that was around 24%. And then roughly 1 in 4 students reported repeated requests for the same information, really just kind of underscoring significant friction in the background check experience. One of the key pieces we've heard, if I can show you in this difficulty of uploading documents, is that students are having to upload the same document multiple times. Though that document for immunization tracking might have a multitude of their vaccinations included on a single page, through other providers, students are having to upload that same document multiple times. Also, they're getting error codes while uploading that, just further delaying them from getting that. They're getting frustrated. I'll talk a little bit more how Student Check helps solve for that pain point on the student side. So really the data from both the students and the admin points from the admin side really points to a unified, human-centered, one-stop shop screening platform as really a strategic necessity for the schools and the students. An integrated solution is kind of a must because it helps consolidate the screening, the documentation, and the placement readiness into a single user-friendly interface, right? What does that mean? Platforms like Student Check are well positioned and working with a lot of schools to help fill this gap by addressing the specific realities and needs of clinical training and healthcare education. So that kind of wraps up the survey portion of what we've conducted thus far. I guess we're doing questions at the very end. So how does Student Check help solve for this quote unquote shortage of nurses being readily available for clinical rotation? We're built for the modern healthcare education, right? We are a fully integrated platform that can support all phases of healthcare student screening. As I mentioned, it's from background check to self-scheduling drug screen to easily uploading and complying with all immunization or vaccination compliance tracking. A real life scenario around that is one of our clients, Galen College of Nursing. Mr. Dr. Tim Frederick actually provided this quote to us. Before they came over to Student Check, they were with a large provider out there. And he stated that when compliance fails, everyone is at risk. The student, the patient, the facility, and the school itself. what we found out with Galen before, as they came on board with us, is that there was a lot of growing risks around their current past background screening solution. They were identifying numerous falsified records based on our help of identifying that for them. And there was even a couple of instances where missed felonies were we found that were marked as cleared as part of the student's background check details, right? That put at risk Galen any partnership or affiliation agreement they had with every single clinical site if there was ever to something like that be caught by the clinical site itself. Um, we're talking about a high stakes game here, right? We're working with health professionals going out and taking care of our loved ones in hospitals. So we need to make sure that we have the accreditation, the contracts, and that the reputation of the schools we work with is really on the line. We need to ensure that compliance and the accuracy is done 100% accurate every single time. Right? They needed more accurate. They needed faster turnaround times, as mentioned. 1 in 4 schools are looking for that as well. And they really wanted some human oversight when it came to evaluating the immunization tracking piece of it. So how does Student Check do all that? We aligned with all of that, plus Galen's mission and their culture, right? We don't just have a canned solution. We come to the table and work with every single client of ours as if they are our only client. We ensure that everything is fully customized and configurable to the needs of every single client. And that could even differ from the 12 schools as part of the IEDRC. If there are slight differences, we'd work with schools individually to help with all of that. And that spans across the United States. Another big partnership that was announced, and hopefully some of you saw this, because I know Odin did send out a message through email for any Odin member. In 2026, Odin announced that we are now their exclusive partner for background screening, drug testing, and immunization tracking. And really, what does this partnership afford Odin members? It ensures compliance through our one-stop shop solution, accuracy, faster turnaround times, on top of receiving an Odin discount that we afford to any Odin member. In the first session, Wendy asked a question to Georgia around, if a program is not an Odin member, but another program is, we would definitely work across all bandwidth. As long as there's some type of affiliation or membership within Odin, we could afford those specialty discounts to an entirety school and or consortium. So Student Check, how do we help, right? I've talked a lot about some of the issues out there, but how do we help those schools make sure that their students are ready for clinical rotation? Well, really, we have a very user-friendly and intuitive interface that provides faster results, real-time compliance tracking, and it's just a lot easier to use than the competitors out there. Some of those things, right, from the criminal background checks, I mentioned we don't have a canned solution. We would work with you on the specifics that you need based on any of your affiliation agreements or attestations to make sure that we are finding the crimes that need to be found per your agreements. Drug testing, we actually utilize a blended network of labs. So we partner with Quest, LabCorp, and the eScreen, now called Alere Network, and they're it's 12,000 clinic collection sites across the US. We allow students to self-schedule that through electronic chain of custody, and it all includes the MRO review as part of the process. One of the bigger takeaways from Student Check, and I've mentioned this before, is around the immunization tracking. Some of that human intervention is what schools were looking for. What's really cool around our tracking solution is that every single record and or document uploaded into the system is reviewed by a health records professional, right? with real-time compliance dashboards. So you, as a user of the system, have direct access to see exactly what's uploaded by the student, what's processing, and what's been cleared as compliant and or non-compliant, where we would take over communication with the student to assist them in getting those cleared for any non-compliant vaccination. Again, anytime we hear human intervention, we think that's going to take much, much longer. But since we have such a great team and a knowledgeable, experienced team, 48 hours is our standard turnaround time for reviewing and marking compliant or non-compliant on all immunization documents. Just leaps and bounds faster than what we're hearing across other providers. So that's kind of what we do, but how do we do it differently? Where does Student Check do that appeals to the masses, right? I mentioned the user experience. So we offer that very intuitive, mobile optimized interface for the students. So what does the student do? They can do everything from inputting their information for the background check, scheduling their drug screen, to even snapping pictures of their vaccinations directly into the system. And it's a single workflow. So they're not receiving separate emails anytime they do a background check, waiting for a drug email to come out, waiting for an immunization. It is a single task wizard workflow that's readily available for the students. As I mentioned, drug testing, background, immunization, all are recorded and processed within 48 hours. The background check, 80% of them are completed within an hour. So again, we've heard the biggest complaint around inefficiencies was it's taking too long. We have cut that out of the equation and said, hey, students upload within 48 hours, you're going to have the results of all of those, all the data points that the student has brought to you. Again, as I mentioned, we don't have a canned solution. We have many configurations and customizations, making it flexible for each and every client and school that we have, whether that is a private school, a university, an associate's degree school. We work with you to make sure that you have the best solution readily available for you and your students. Visibility, obviously, reporting is a huge piece of that. You need access to it. We can definitely provide that to you. It's at your fingertips of how you want to break it down. You can do it by school location, by program, by cohort, by student, however you want to do it, all readily available for users of the system. And I think the last one here, and maybe the most important, is the support. And I'm going to say not just customer support, because we have both customer and student support. Many times, a school might have a question that is drastically different from that of the student. Students typically need to reissue their login information or password. We have the ability to proxy in with the student to help them in any way possible. We provide a full white glove treatment to both students and our clients to ensure that you're not left in the dark with any questions that you have. We give you phone numbers, emails, chat features to get those answered as fast and as accurately as possible. Last piece is just kind of we catch what others miss, right? We've been doing this for over 30 years. We work with, we have been screening over 90,000 students annually, and that number is just ever increasingly growing as we're bringing on more and more institutions. I think the biggest one to call out again is a 32% reduction in turnaround time is what we're seeing on average from our competitors, right? That 48-hour turnaround time is just something that has been so phenomenal for the schools in getting these students cleared as fast as possible. I'm going to wrap it up there. Again, I'm Brad Gary with Student Check. I really appreciate everyone taking the time to be part of this and listen today. I'm happy to field any questions that y'all might have for me.